What's up with y'all, man? We in here. Cass is in session. Got Dr. Khan. Lazarus about to tune in.
What's up, Cass?
Doc, what's up, man? You know I couldn't miss my doctor's appointment, man. What's up with you, boy?
Yo, we had a doctor's appointment and we had said it, and I was like, yo, what time zone is gonna be, Cass? It's gonna be Eastern time. You're in New
What's
York,
up?
right?
Nah, I'm in Atlanta right now.
You're in Atlanta right now. All right.
Yeah.
I'm on the west side, man. I'm in Vegas right now.
Oh, so you on a different time zone?
Yeah, I'm in the Pacific time zone right now.
Still look nice and bright out there, man.
Yeah, it's still nice and bright, man. It just started raining a little bit, to be honest with you.
Oh, all right.
Yeah, man. How you doing, though, man? How you been during these hard times and shit?
I be pretty much quarantined in anyway, so it's normal for me, man.
No, that's great, because that's what I recommend for everybody right now, man, is to stay inside with the virus spreading around like it is right now still.
Nah, you look nice and healthy though, man. You look healthy, man.
Man, I cleaned up a little bit, man. I was literally in the trenches, bro. I was in the hospital. I worked like 3 weeks straight, more than that really, and I was just, I'm trying to take care of myself the best I can, man. But it's been pretty wild out there in the hospital, bro.
That's what's up, man.
It's crazy, man.
Couple people starting to tune into the live, so explain to the people that's in the live who you are, man, in case they might not be familiar with your background, how long you've been doing it. They might just think you a doctor. They might not know all the other things you got going on in life.
So, man, my story, man, is that I'm from, first of all, I'm from Detroit City. You know what I'm saying? So I came up, as a battle rapper in Detroit. That was kind of what I did before I even went to medical school. So my journey is that I was doing hip hop and I was doing medicine at the same time, pretty much since the beginning. You know what I'm saying?
Our timeline is similar too, man. The same year we was born.
The same age too, bro.
Born the same year.
July 82.
Yeah, for sure. Yeah.
Oh man, we the same age. So yeah, man, I came up in Detroit, man, and as I was doing the battle raps on the ciphers at the campus, I was studying biology. I was a biology major, and then on top of that, man, I got accepted to medical school. Did the thing, man, studied my ass off 16 hours a day, but I still put out records and mixtapes and did that. In 2013, Russell Simmons brought me to his crib, man, to do a performance about ethnic understanding. So after that, I got put on All Deaf Digital. I did some records with Worse to 5'9", D12, and all them cats. Those my homies from Detroit, man. And then, you know what I'm saying? And just recently, I've been on the road with the Wu-Tang Clan, man. We did about 20 plus cities around the world.
Decapitation Chamber, right?
Yeah, the Decapitation Chamber, the record I did with Ghostface Killer.
Yeah.
Yeah, shout out to Ghostface, man. Shout out to Divine 7'9". Yo, that's my family.
Yeah, shout out to the whole Wu-Tang, man.
No doubt,
Legendary
man.
group been holding it down for years, man. So
yeah.
you got a little history. I heard you won the Underground Mixtape Music Award for the Song of the Year too.
Yeah, I did. I won the Song of the Year, man. It was the same year Joyner Lucas was up too, man. I did a record called Open Heart Surgery. Bizarre from D12, I actually had him lying on the operating table, man, and I was doing open heart surgery lyrically on him on a record.
That's
so
great.
It was a way for me to put the rhymes and the medicine together. You feel me?
Yeah, that's dope, man. And nobody could do that other than you, because nobody ain't got that information but you.
Right, no doubt, man. It's fun. It's just like I'm taking two worlds and I'm trying to piece them together. And I'm in tune with the hip hop. Chuck D is a mentor. Like Chuck D rides really hard for me, man, and I love that man to death. You know what I'm saying? He's been a guidance to me, and he's been a personal mentor to me since 2014. You know what I'm saying? So
you can't go wrong with Chuck D in your corner, man.
No doubt, man. No doubt. And
For real.
like right now, man, I'm just trying to spread the awareness, especially in the hip hop community. Cause man, every doctor ain't gonna give you the real and give you the real like I give you the real. Because I'm in tune with the culture. I came up the way I came up, so I have a different perspective than other physicians might have, man. So, you know, I definitely want to put the message out there because a lot of people, they have a certain feeling of questions whether this is real, whether this is not real, whether this is a conspiracy, whether it's a 5G radio frequency that's causing a virus and all this stuff. And to be honest with you, I'm not over here to tell you whether this was created in a lab or whether it came from bats or anything of that, but I can tell you what I see in the hospital.
Okay.
And I can tell you what kind of symptoms patients have when they're in the hospital and what kind of treatments have been working and things like that. So, you know, I kind of started seeing this the first time in the middle of March. You know, middle of last month is when the patients first started showing up and started having symptoms. You know, at first I thought, okay, these guys just got the flu. You know, ain't no big deal. You know, even if I catch it in the hospital, everybody, think about it, bro. All the nursing staff, all the doctors, everybody on the hospital floors scared to death because you hearing all these stories about China and Italy and people dying and everything like that.
Yeah.
We still took it lightly because we was like, yeah, but come on, man. People just blowing this out of proportion. You know what I'm saying?
For sure.
I was thinking the same way, bro. Like, I was on the same mindset. I was like, yeah, you know, it's just going to be something fast. So what if I get it? I'll be fine in 4 days, 3-4 days, just like the flu. But it's like when I started seeing the patients and I started seeing younger, and they said it was only affecting the older population. I'm like, oh yeah, I mean, I'm healthy. I ain't got no medical conditions. I'm good. But man, I started seeing young patients in their 30s. Like I saw this 32-year-old female, man, and she had these symptoms like she was a 90-year-old with her breathing. She looked like she had COPD. She had like the worst lungs in the world. And I'm like, I asked her if she had a history of asthma or anything like that. She's like, no, I don't got no history of asthma. I don't got no history of any lung conditions at all. Matter of fact, no allergies, nothing. And she was miserable. And she was like, Doc, am I going to die? And that's when it hit me, Cass. That's when it hit me. And I was like, yo, something's going on. This, like, I'm seeing it right now. This is serious stuff right here. So from that point onward, man, I was just, there's a certain thing I had to wrestle with every day I went to work. Because now I'm like, I don't want to catch this. Before I was like, so what if I get it? I'm like, no, I don't want to catch it. And I start seeing more patients getting sick and being upgraded to the intensive care unit, being put on a ventilator. I'm like, man, that's not what I'm trying to do right now. And
Sure.
my hospital start taking their shifts off. They're like, nah, we ain't coming to work. We ain't coming to work. You know, and I had to muster the courage up to say, no, man, fuck it, I gotta go. You know, I gotta go and try to figure this thing out. So
Because the people need you.
I've been kind of on a campaign, man, just updating people on social media. You can find me at LAZ Detroit on social media. I'm just updating people on things that are being tried from the hospital. Now, when people say certain treatments work and certain treatments don't work, to be honest with you, there's not enough cases, you know, clinical cases for us to know for sure if this medication works or not. But what seems to be working for me in the hospital on the patients that I've tried on is that medication is called Plaquenil, hydroxychloroquine. It's a medication they use for malaria. You know, it's a medication they use for rheumatoid arthritis. And I noticed that when that medication is started right when the respiratory symptoms start, that you can get better in about 3 days. The problem, though, is that, man, the test to find out if you have COVID-19 takes 3 days. So you send a swab out, you ain't going to get results back for 3 days, and you just kind of just lingering, you know, hearing your ass, not knowing what to do. But I've been starting patients on it who have the symptoms. So these are the symptoms, basically. So you start off, you're going to have you could be asymptomatic for up to 2 weeks. You might have no symptoms at all. And that's the thing that's bothersome, is because you end up, you know what I'm saying, having no symptoms and you're spreading it to all types of people without knowing you're spreading it.
Well, first of all, before you get to spreading it, break down how a virus can spread, because I know a virus is not a living thing. So how can a virus spread? Like, some people might think that it's just airborne, like you can walk outside, just breathe the air and catch it. Some people think a person has, you know,
there's a lot of people talking about it being airborne, but it's not. It's gonna stay in the air and fall. It's transferred through respiratory droplets. Hey, first of all, can y'all hear me? Somebody said I was low. I just want to make sure y'all can hear me clearly.
You got a little better for a minute. You got a little louder for a split second, and then you got a little lower again. I can hear you, but you is kind of low.
What about now? Can y'all hear me? Mic check.
It's fine.
It's fine right now? Okay.
I can hear you, yeah. I can hear you.
Okay, bet. Yeah, so you asked about how it spreads. So it spread through respiratory droplets. So when somebody coughs, sneezes, or if they take a deep breath and exhale deeply, those respiratory droplets come out. And that's when, you know, and it gets to the other person when it enters their eyes, their nose, or their mouth. Now, if this thing was in the air, Cass, every person would have this damn virus right now.
For sure.
You know what I'm saying? It's not in the air, just like the flu. It don't float around in the air like some kind of.
And just like AIDS, just like somebody that had AIDS couldn't bleed on the table, and then you come back the next day and touch that table that they bled on and get AIDS.
Right. So you know this
because the virus would die outside the body on the table.
So this virus, this ain't about 3 days. It can last on surfaces for about 3 days. I don't know how true that is or isn't, but obviously we want to take the precautions to make sure that if we touch surfaces, we constantly, regularly wash our hands, you know. And when they wash your hands, make sure you get in the crevices, fingernails, make sure you do a thorough, you know, 20 seconds, clean them hands real good. You know what I'm saying? And then the distance thing is always that's they say that, and it's very important. You got to maintain that 6 feet of distance from the next man, because obviously we don't want that respiratory droplet to come in, and that's how we get infected. That's how it's being spread. So right now, once the symptoms start, you're going to end up having a fever and a cough. That's usually the first thing people notice when they have it. Okay. You don't have too many of the, like in the flu, you get the sniffles and everything like that too. And this is more, it's more just a high, like a 102 fever. And you're going to say you're going to get some chills and you're going to get this dry cough. And then you might get better after that phase of the virus goes away. So that might be for like 3 days, and then you're completely fine for 3 days, and you think you just had the flu. And then that's when the virus goes down into your lungs, and that's when you start really getting serious symptoms. And that's when you can't breathe. And that's when you feel like, man, my lungs is giving up on me. Yeah. That's the time we need to start the medication right away. So I advise people to go to the hospital as soon as those symptoms come and you can't breathe. Get your ass to the hospital, man, because you need that medication to start right away. For sure. Because if they wait too long, then the lung damage. See, what happens, bro, is that the virus gets into your lungs, and it's not just the virus that's damaging your lungs. Our own immune system starts acting crazy, and it actually makes it worse for us because your immune system don't know what's going on. They start punching the walls of your lungs left and right. So what we need to do is get this medication. It's called Plaquenil. It decreases your immune response to the point where you don't damage your lungs worse than they need to be damaged already by the virus. So there's no real way. So the people, I know this like this flu season too. So a lot of people could be getting the flu or other kind of symptoms that's similar to that. Still going around. I still have patients testing positive for flu still to this day. Yeah, so it's still going on. So you might have the flu. And so the difference would be the difference would be most of the time with the flu, you get the sniffles in your nose, but with corona, you don't. Right. Yeah. You're going to get the sniffles. There have been patients with corona that have it too, but corona is more specifically fever, dry cough. And then it goes away and then you can't breathe. That's kind of the general, you know what I'm saying? But you don't know for sure in the first phase. It's when you start having difficulty breathing, it's when it's like, yo, this person's got it. All right. Especially when they got a fever and they don't got the medical history, they don't got the medical conditions. Because you know, a lot of people that are older, you know, that have heart disease and people that have lung disease, those people are getting really, really sick, man. I have so many patients that are still in the ICU and they're not getting better right now. Yeah, so they just staying sick. Just staying sick. I mean, we're trying the same stuff that we're trying on the younger patients and the patients that we diagnose right away. But they're saying that the ventilators might actually be making them worse. Now, I can't say for sure that that's happening, that's legit, but there's a lot of talk out there, you know, in the medical community that the ventilators can actually make the virus spread more. So what about the people that did get better and that did beat it, the younger people? Like what do they might have, or so they might, what is making them be able to beat it easier, and then some people seem to get so sick and die. Right. Because so everybody's
they kind of publicizing like everybody that they get corona get the worst case scenario, like you're going to
Yeah.
get sick and
No,
die. That's why everybody's
and
so panicky.
and you know what, Cass? There are a lot of people that got it that don't have it as bad as other people. So I've seen people that have been able to fight it off. I mean, it's difficult for everybody, but I've seen people that actually were able to fight it off and not go through the craziness that a lot of other patients went through. And one thing I could say to contribute to that is boosting your immune system. You feel me? Like, that's why I advise and I tell everybody, like, man, make sure you take them vitamin C's. Make sure you're taking ginger. Make sure you're taking the black seed and you're taking NACs, you know, to boost your antioxidants in your body. Like, those things are very beneficial. So if you're keeping yourself healthy, you got a better immune system. You can fight the virus better than somebody who has coronary artery disease and hypertension and diabetes and things like that. You know?
Yeah.
So most definitely,
So
man.
it seems to be really affecting people that got previous issues that they dealing with, and it just make those issues harder to deal with once corona come.
Right.
But if it's like a completely 100% healthy person and their immune system is normal or above normal, they usually could fight it off and
They
get
usually
better.
can. Now, there have been people that have no medical conditions and their situation gets critical. But for the most part, you know, if you're healthy,
Or what about in reverse? Has it been any old people or people with those type of conditions that's
yep,
supposed to be bad but fought it
yeah.
off? And
You've seen both. I've seen both sides of the fence. I've
okay.
seen, but if you were to, if I was to summarize and tell you that, like, the patients that are older and have medical conditions, generally those patients are going to do worse than patients that don't. So that's,
Yeah,
I mean,
for
that's pretty
sure.
much common sense, and it plays out like that as well.
Yeah.
But the most advisable thing that I want to say to the people, though, is that, you know, a lot of people out there, you know, they're not really caring about it because they like, yo, I'm young, I can fight it, no big deal. But it's when you're around your elders, you know, when you're around your parents, your uncles, your, you know, aunts and stuff like that, you don't want to spread it to them because they might not be able to fight it.
Well, totally all together now. I'm talking about throughout the whole world since Corona been around. How many people approximately died?
I'm trying to think. I know in the United States it's like about 45,000 people in the US that died. I don't know the worldwide numbers off the top of my head right now, but I know in America we have like 820,000 positive cases and about 45,000 deaths. And it's still steadily like about 25 to 30,000 cases coming every day. And we're trying to get that number to start coming down. And that's why we're still in quarantine and everybody's still staying at home, is because we want that curve to start coming down. And it's not, we feel like it's peaked. It's past the peak now. We're just waiting for the numbers to start coming down comfortably. So I know Trump is like, you know, we want to try to get everything back to normal, but we need to give it its time and make sure we don't flare it back up by putting everybody back in, you know, congregation.
But another thing, it's a thin line between it, because now that the shutdown that they're trying to keep people safe from the disease, with the disease starting in other continents like China, that's like crazy populated, there's billions of people over there. And if only 45,000 people died, and 40,000 people die every day for just
right
for anything, just not because of Corona, just period.
No, that's a fair statement. Yeah,
40,000 people die a day.
Yeah,
already. A lot of these people that's dying nowadays, they're not able to do autopsies or studies to show what's killing them. They just blaming it on Corona.
Yeah, so, no, true. I see that angle as well.
But it's millions of people that's out of work right now and that's suffering from being locked in.
Exactly.
There's millions of people that have medical issues that can't see their doctors or can't get their medicines or the things that they need, that's suffering. You know what I mean? There's wild people that's stuck in like prison facilities that can't go nowhere, got to get told where to go and how to move and what to do. That's might be next to somebody that's infected and still can't do nothing about it.
Yeah,
it's like millions.
It's a lot of factors. It's multifactorial. It's not
but
just
it's
one
millions and millions of people suffering.
Yeah,
and it's only, I mean, I know you're saying it's a lot of people that's infected, but a lot of those people is beating it. And then even the ones that's not, it's still a small percentage of the billions of people that's in the world that's suffering from this.
Right. No, I'm completely with you on that.
That's the thing I'm having a problem with. Like, I want everybody to be safe and I want everybody to take precautions and do the right thing. But at the same time, what they telling you to do to be safe is also putting even more people in harm for different reasons.
Right. But yo, Cass, on the flip side of the coin, if we were to let everybody go back to normal, And if this thing did start spreading at 5 or 10 times faster rate than what it is now, then we could end up getting the type of mortalities that are catastrophic. I'm just saying, you know what I'm saying? Because especially when our older population is starting to die from this virus because of how serious it is compared to the flu. So there's a lot of ways to look at it, but I completely agree with what you're saying at the same time, because it's not like, oh, everybody's at home and now everything is happy and peaceful. People are still suffering. People are dying. They're getting laid off from their jobs, and all that stuff is happening right now. So I feel exactly what you're saying.
A lot of people are suicidal.
Yeah.
Like one of my neighbors just passed away earlier. I seen like fire engines far away, and I heard noise and seen a lot of cops. I'm asking my wife what it is. Man, checked out, man. It's hard times. Like, you know what I'm saying? He was an older white guy, but he still checked out. And it wasn't nothing to do with Corona. It's just like people stressing right now and going through a lot because of their conditions. Right. So it's like, it's just, that's what make the times even rougher. Not just the disease, but all of the things that's coming along with it. Right.
No, I agree. I mean, everybody's going through it. Nobody's able to live their life normally right now. You know what I'm saying? People ain't even mingling with their family members. You know what I'm saying? I ain't seen my parents. You know, I'm cutting on me. It's like a lot of stuff going on, man. And, you know, people can't even, you know, properly go out and do their businesses, and all businesses are plummeting. Also, it's just now what we're relying on a check that Trump is going to give us. And who knows what, you know what I'm saying? Like,
and it's scary to even find out if you really do got it. Some people might got symptoms, but just want to pray to their God that it's not Corona, but don't want to get tested because it's a lot of predicament where you can't see your family, nobody can see you. You fuck around and just die by yourself and never see nobody. Just being scared, just out for anxiety, just being scared. Because I walked around, man. I went over to you know, Olive Garden restaurant yesterday to get some food, man, and the people working over there, you know, they were scared to death of me just to come near me. I'm like, yo, man. Even I had a mask on, still they scared. I feel like, alongside of what's going on and what I see as far as the virus itself, but the actual, you know, situation outside of the hospital is also, it's people are acting incredibly insane as far as their reactions to other people and just how to manage in this situation. It's never happened before, bro. Never in the Earth's history has something like this happened where everything just gets shut down and paused. And there's different levels of understanding in the public. So some people did more research than others. Some people just listen to the news. Some people just listen to what somebody said on live, like what we doing now. Some people go deeper into research. So everybody got a different level of understanding, but they all coming together. And that's what caused confusion. That's what caused problems when everybody not agreeing, because everybody not on the same level of understanding about it. Because even the experts don't even fully act like they, like even you. You still trying to get it and figure it out. It's not something myself. It's not even something the experts got down packed. So it's going to cause the public to feel even more crazy. Right. I mean, I can only give what I advise based on how I'm seeing and what I see in front of my eyes. If I was basing all my research off of things that people are typing and writing on editorials and this and that, then I would be completely confused. I can only go off what I see. For sure. So when I see patients that are sick in the hospital, I'm like, yo, we definitely got to take precautions. I don't want to be like that. I don't want my parents to be like that. I don't want my family members and close friends to be like this. I be having a bunch of people asking me to go live and talk about different things, but most of the time I don't be having the time. I'm gonna start a little more, but as soon as you told me about this and we talked about this, I couldn't wait because I wanted the people to hear the information coming from you, somebody that's dealing with it hands-on. You know what I'm saying? Not just some person in the news that you never met. You don't know where they coming from, what's their agenda. You know what I mean? And I appreciate you taking the time out to do this, bro. You know what I'm saying? I really, truly appreciate it. And you know, just on another topic, man, you know what I'm saying? You a legend in the game, man. I just, you know, my hat's off to you, what you've accomplished, man, just being a crossover from successful. Appreciate that, man. And being successful in the battle world, man. You one of your kind, you feel me? Thank you, man. Appreciate you, bro. Salute, man. I truly appreciate that, but yeah, I heard some bars. I heard some bars the other day that you just gave to Vlad. You just tore his interview up, man. Oh man, thank you. Yeah, y'all need to check that Vlad TV interview out, man. Shit. For sure. Vlad is cool, man. I'll bust some of those bars right now, man. Oh yeah, I would love that, man. The crowd will love it too, man. Yo, check this out. Another obstacle. Another hectic day at the hospital. Is finding the treatment possible, or is COVID-19 unstoppable? Here concentrating, contemplating. How we gonna be safe when people out there congregating, not listening? Conspiracy theory talk debating.
It's just another cold or flu. That's what the rest say. This pandemic got a 4.2% death rate. You spread the virus without knowing it for 5 to 10 to 12 days. That's when you get the fever, cough, and then your chest aches. Viral pneumonia hits is when you cannot breathe. Life-threatening for sick patients and elderly. Ventilators get used up, there's lack of supply. If we keep spreading the virus, your mom and dad could die. We got no vaccine, but medication is getting near. I'm treating my patients with lopinavir and ritonavir. Plaquenil for immune response to get severe. Clinical trials show success with favipiravir or Avigan, being used in China and Japan. So what's the battle plan before stress, anxiety gets you to Ativan? Everybody stay inside. The whole mission is to stop the spread of the virus through social distancing. So wash your hands, cover your face, protect your family. Let this time be a reminder we are humble in our humanity. Say your prayers, control your fears, and keep your sanity. I'm about to go in now. Coronavirus wants to battle me. Feel me? Yo, Cat, yo, I got something for you. Check this out, check this out. Yo, I feel like spinning some bars. Check this, look. Yo, bars forever, baby. Look, spreading like a stage 4 adenocarcinoma. Striking like an African cobra. Leave a trap rapper trapped in a coma like they have a neuroma. The only rapper bragging that he have a diploma. Lazarus rose up when Allah gave the power to Isa. Peace be upon them, but not a problem is a devouring feature. Bring Tarzans, I'ma show you in his jungle I'm Caesar. Something like ether, leaving him seas, body for sport. Charge rape on stations, playing Little Yachty in court. Deport Donald Trump to Scotland. Demanding a bank some ransom while I'm holding a Rothschild's child hostage. Hunting your pots prosperous. Ain't no competitor, one a vendetta with the predator ready to sever the head of these false prophets. When I drop this, I'm drawing a picture to get you to think I'm like a Picasso, making your mind grow. 2007 originated the God flow. I'm like a cocaine joke that comes rushing with every percussion that causes a concussion. When I come running up on me, you saying Pope. Entering Salahuddin. Chop the heads of opposition. My position in proposition is slay the competition of position. Flips the will to a mic magician. I fight resistance with a Wu-Tang and my assistance. Cause all these record labels do is teach hoes out of deep throat. Cut off the heads of Migos and 3-point with a free throw. Nowadays, these MCs who see class got egos. I ain't no gangster, but I flip fast to my Bean Siegel. Bump a koozie verse. Run my Maserati over Yachty, or should I spray my Uzi first on Uzi Vert? I rule the universe. Refuse to be immersed in idiocracy, and being raised in the 90s is my curse. When ain't no rappers walked around with pink dye addresses who make rhymes senseless, criticize, get slandered, leaving high minds defenseless. I'm restless. Lazarus is signed on to his death wish. The kamikaze for the culture, blow you up and go and eat your bomb doors for breakfast. You want to try to weigh me down, portray me like a mutant, but I lay down the laws of gravity like Isaac Newton. Zero contribution, having blood-sucking Rasputins. Zero para, nuts and diss me back while I throw back the boom bap, reload the golden era. Rub your soul with aloe vera, breaking down the barriers. Kidnap Trump before he throws another bomb on Syria. I'm what a sickle cell trait carriers to malaria resistant. The face of World War III was scarier. Came from rock bottom to bite haters like Rottweiler, snatching off the belt from the champ Deontay Wilder. A crossbreed with a big L, Jizza, and Nazabi. Step on your leader's crown like Galvatron to Starscream, the highway of my way. Taking Nazi cinnamon chains into Zimbabwe. Try to come and stop me. I'm the sickest, wickedest boogeyman like America made of Osama. Wrap the heads of rap gods around my neck like anacondas. Come to take the throne despite your willingness with honor. Like Killmonger came to Wakanda to take it from T'Challa. Last army, Lazarus.
Lazarus!
Yo.
That shit was crazy.
Hey, yo, Cass. I know you ain't heard no motherfucking doctor spit like that before.
Nah, niggas gotta listen to that over and over again, man, because you was talking some shit that niggas gotta go to Google and look up all the medicines, all the places on the map, all that history that you was bringing to the table. Niggas gotta study to understand that, man. Salute, man. You got bars. We gotta work, man.
No doubt, G. Yo, I think you can make a historical record, G.
Oh, for sure. I can't wait, man. Whenever you ready, whenever we get together, when this shit clear up, we got to make that happen, man, for sure.
No doubt, man, for sure. That's got to be a must. But, yo, man, everybody make sure you follow me at LAZ Detroit, Laz Detroit. You know what I'm saying? Check out that Vlad TV interview. And, yo, Cass, man, it's a blessing.
Check out everything he did, man. This boy get it in, man. And
Shade 45. Check me out on Shade 45.
You also did my boy DJ Thorough. This is 50. I seen you on there, too.
Okay, bet it up, bet it up. Yeah, man. I'm trying to. You know what I'm saying. I'm in the Clark Kent zone when I'm in the hospital, man. But when I get in the booth, I take my hip hop real serious. You know what I'm saying?
Right in the Superman on him.
Got to do it, G. So
Yeah,
yo,
yeah.
Cass, man, I appreciate your time.
I appreciate yours too, man.
You know, and everything you were saying also, man, it makes perfect sense because it's multiple sides to this story. You know what
For
I'm saying?
sure.
And one side of the story ain't right. But you know what I'm saying? I just wanted to give my perspective of
We
what I'm
living
seeing in
through
the
it, man.
hospital.
It's gonna all come to the truth while we in a minute, you know what I'm saying? But we going through it now, so we figuring it out.
Sounds good, man.
But I appreciate you for helping us, man.
For sure, absolutely, man. So yo, Cass, man, I'm gonna let you go. Have a
Salute.
safe and blessed time. And
To
yo,
the, now
look
we
out
gonna
for
keep in
Lazarus
touch
Cass,
though,
man.
man.
We about to throw some fire on these motherfuckers.
Nah, for real. I'm gonna
All
text
right.
you. We gonna get it right, man, so we can make it happen, boy. Salute.
Peace out. Salute. Yep.
Easy. History, man. The doc just came in, man. I just had my doctor's appointment. I had to get y'all the rundown on what's going on with this COVID stuff, man, because I need some answers, man. For real, for real. Definitely need some answers, man. Lazarus get busy though with them bars, man. Niggas start talking about some all type of shit, man. The nigga jumped in his bag. I gotta play that shit back myself, man. Who in this live with me, man? Wow.